Last time I was in a packed room, LSU beat the you-know-what out of Georgia Tech. And hopefully we'll have a better outcome for Georgia Tech this time around. Some of you may know I moved here from Baton Rouge, so I'm the only person that's been driving around with an LSU Tiger sticker and a Georgia Tech sticker on his car for the last year and a half on opposite sides, so I felt right at home at the Chick-fil-A Bowl. I also feel very much at home in this building. Georgia Tech and St. Joseph Scientific Strategic Alliance affiliation agreement several months ago, and been working on a number of research projects together. As you know, we don't have a formal medical school affiliation, and Georgia Tech doesn't have a medical school. They've got a lot of very, very crafty and knowledgeable engineers and scientists, and we've got a lot of good physicians, and we wanted to get those folks together to work on things together, so thus our affiliation agreement with them. I also have a personal interest in the work that you all do. My son's a junior in computer science at Caltech, and hopefully he'll have a job someday in one of your sectors. So I'm hoping that just about the time the economy picks up, he'll be ready to look for a technology job. I'm going to respond today a little bit about the financial crisis, what it's doing to healthcare, the decision makers in healthcare, and really there's 6 sectors that I'm going to briefly talk about, and I'll hopefully respect your time. Hospitals, doctors, insurers, the government, suppliers, contractors in one sector, and the patients themselves. I'll talk about the one that I know best first, and that's hospitals. This has been a multiple whammy, a perfect storm for hospitals, if you will. The strong will survive this, the weak may well not. We're seeing some signs of that in this community already. Patients are putting off elective procedures. This really started in early September, and when they have the discretion to avoid a large deductible or to avoid a visit to a physician, which are generally not pleasant affairs anyway, they're avoiding them. I started talking with surgeons and other folks who have a large part of their practice in areas that would be considered elective as opposed to must-dos for illness where you can't avoid seeking the physician's care. And all of them are off 15 to 20 to 30%. Plastic surgery is the hardest hit, as much as 40% off in their volumes. The most discretionary of all the various areas. I'll try to hold this at the right distance. The only one that's going to have probably a delayed effect, and don't laugh, but it's true, is obstetrics. You'll see that begin in several months in terms of the effect on hospitals that have a large obstetrical volume and what it will do to their finances as people deliver babies but don't have insurance to deliver them with. We are beginning to see another delay now starting a week ago as new deductibles kick in for most health plans on January 1st. There was a little bit of a rush at the end of the year to get a few things done as people finally delayed putting off things, but that was principally in diagnostics and some very small surgical areas. So patients are avoiding getting the necessary routine testing that they need because in part they don't want, and this is evidence from physicians, they tell me they don't want to hear the bad news from the physician that requires them to get another test or an intervention to resolve the information that is found out. They just assume not know, which means eventually the piper will have to be paid, and it just pushes if there's a pile of dirt in the highway and you keep pushing it on down, it's still in the highway, you just have to deal with it eventually. We do know the unemployed are generating more uninsured. There's roughly 8 million more uninsured today than there were on September 1st in this United States. And I mean uninsured, not underinsured. I think President-elect Obama intends to address that. We'll see how successful he is. Bad debt is now increasing on a rapid pace. Our bad debt as a percent of net revenue is up about 1.5% from what it was 6 months ago, and I think that's true of almost every other hospital in town. These are individuals that have the capacity to pay but are having to make choices between who they pay or they have lost the capacity to pay that previously might have had that capacity. And this is true especially of folks that are having to visit the emergency room. The payer mix has changed as some people have lost positions and have moved to Medicaid. That's a less profitable payer mix for hospitals than it was before. And, of course, it's stressing the state coffers as more and more people go on Medicaid rolls than the state predicted, and the state doesn't have any money to pay for them anyway. Doctors are looking to hospitals to supplement their doctor income. They've lost volume in their offices, and they're come running to hospitals either to buy their practices or to supplement their income, since they see us as an island of refuge. There's certainly a credit crunch for hospitals. So the first one basically is a loss of business in this triple whammy for hospitals. So it's a loss of business from, especially in the elective side. And if you're in a hospital that has a fairly large preponderance of elective kinds of procedures or cases versus required, meaning the patient can't avoid it, you're going to get hurt a little worse than others. Ambulatory surgery centers are getting hurt quite a bit because they're principally elective and very often not elective. The credit crunch is the second one. A lot of hospitals that have to live on credit are increasingly in difficulty. Interestingly, interest expenses both up and down. Long term, if you had auction rate bonds and you had to refund those, your interest is up. But if you have short-term interest, that's down. So it's kind of a mixed blessing there if you can get credit. Most hospitals have decent credit, but some do not. Leasing funds are difficult to access now, and sometimes that could affect a tech purchase because some of those are in lease situations. There's less available capital for leasing. Obviously, the third whammy to us is the portfolio incomes. Many hospitals in difficult times rely on their portfolio to carry them through, the income off those investment portfolios. And those are roughly down anywhere from 25 to 35%, depending on the aggressive nature of those portfolios. And it's true if everybody's in the room, unless you're smart enough to put your money under a mattress in last June. Probably the safest investment anybody could make at that point in time. As a result, many of our pension funds for those hospitals that are on defined benefit pension systems are having to be funded. They didn't have to be funded in the last 3 or 4 years, so hospitals got used to operating without that expense base. Now they're having to fund them, and they're finding out from their actuaries when they get the way the accounting system works. They haven't had to fund them this last year, but they will have to start funding them January 1st when their actuaries yield their new investment results and projections. They're going to have to start funding those defined benefit pension plans. And that's not a planned expense in most hospitals' budgets this year, but it will have to be now. And when those investment earnings are down, of course, they stop buying capital. We're in a 33 hospital system. We've put a capital freeze on back in September, except for absolutely non-essential items or things that are halfway there, if you will, and you've got to finish them. Everything else is very much on hold. Most of the major systems throughout the country have done the same thing, and most of my contemporaries here in the community have put most all capital decisions, especially discretionary ones, on hold. Not canceled them necessarily, but deferred them. So the good news is that the decisions are still made to make the acquisition. It's just deferred till whenever, until the market picks back up and they have the cushion of that investment income to help them through that. There are some hospitals that are upside down in which they have less in the bank than they owe. We don't happen to be one of those. We're fortunate enough to be right side up, but there are some that are upside down, and they're extremely stressed right now because they don't have that investment income to operate on to help them through. Overall margins for the third quarter in hospitals, we don't have the book on fourth quarter yet, but they've dropped about 10%. Many hospitals were in the plus a year ago in the third quarter. Now, almost all hospitals have drifted into the negative for the third quarter of 08, and I think that's true of most businesses in the country. But that's a new thing for a lot of hospitals, some hospitals in Georgia as well. Responses to that, of course, are layoffs. You've seen that throughout the city. I think I've been counting as I read the press. I think there's about 1,000 people a week getting laid off, not in the healthcare sector, but overall in the city of Atlanta. We're Atlanta tied today just to hopefully do a Chamber of Commerce advertisement for Atlanta, but nevertheless, we're joining the rest of the world. In the healthcare sector, we're part of that. We're probably 10% or so of that. We've done that. Piedmont's done that. Everybody's had a layoff or a freeze of some sort. Pay freezes, deferrals of 403B matches, these types of things. Program eliminations where possible. Some of that is... that winnowing is not all bad if you've been on the edge of a program elimination, and this kind of gives you that impetus to move forward with that. But when those are attacking those marginally funded patients, that's not good. We've tried to hold the course there and not eliminate those kinds of programs. But it's really forced a very much examination of discretionary spending, travel, advertising, education, maintenance even. and certainly anything that would be in the discretionary category. Of interest to the tech sector, I think investment in EMRs is going to proceed for the most part because of the new e-prescribing incentives that Medicare has put out. It may slow down a bit from what was going to happen, but we'll find out more as Mr. Daschle unrolls his agenda. But I think for high-tech equipment that's a risky adventure, you're going to see a lot of deferrals by healthcare sectors for that. And if it has software involvement, you're going to see deferral on that. Most healthcare have difficulty seeing the return on investment for technology. It typically is sold on that basis, but the yield of that is very difficult to see sometimes. And many of us in the field are skeptics about that, and it's considered gravy if it happens as opposed to banking on that return on investment. I think there's a real potential for internet-based activity in retail that's internet-based to pick up. So if you're in that sector, I think that will continue to move as alternative sources. Whenever you have a perfect storm, you look for alternative sources of revenue. Let's talk about doctors and patients quickly. Again, bad debt issues in doctors' offices, credit problems, have patients show up with health care cards that are expired, but they still try to get health care using them, basically being somewhat dishonest with their own physician about the status of their health care coverage. As they've lost jobs, they still try to use a card that they think might still be viable. And physicians that are less savvy than others are suffering because they believe that the card is still active and it isn't. Patients are canceling appointments and deferring them, as I mentioned. The tests and procedures that they might do, they might go to the doctor, but they're getting less tests and procedures, saying, doctor, I think I can do without that, as opposed to asking the doctor for it, a different paradigm than we've seen before. Besides plastic surgery, the other areas affected are general surgery, orthopedics. The internal medicine specialties have not been hit hard because they typically deal with people with illnesses where the health care cannot be avoided, can't be deferred. But the surgical specialties have been hit harder. So if you're selling any product to them or talking to them, they're hurt worse than others. Unless they've already had full waiting rooms and full schedules. Those folks are still doing fine. I think you may see a pickup towards the end of 2009, again, as people start to run out or use their deductibles. But I don't see any relief from this for the entire year of 2009 until the last quarter. Short-term credit crunch. Doctors live on sometimes only 3 to 4 weeks of cash in their offices. Most hospitals have 10 to 20 or 30 weeks of cash. And as a result, they live on credit. And if they can't get credit, which they used to get it automatically. Every bank would just throw money at doctors, but that isn't the case anymore. So they're having a tough time getting credit if they can get it at all. Which means they put off discretionary spending in their own practices. Again, we're seeing doctors do furlough days that they never did before, combining with other doctors, merging offices, putting off recruiting other doctors, and again, turning to the hospitals to help with their shortfall. And I think other than the e-prescribing, you're going to see them defer most tech acquisitions. Insurers. This is a positive negative for them. It's not so much a perfect storm. The negative for them is that their portfolios have been crushed and that their income stream from their portfolio, the float on that many of them live off of, as well as the float on the dollars coming in before it goes back out in benefit payments, has been really hurt. The upside for insurance companies, as patients have put off care, their medical loss ratio is much, much better than it used to be. So they can make money there on premium structures. They'll have to adjust that for self-funded plans because they'll want a drop in the premium structures. So it's a plus minus for insurance companies. But they will probably raise some rates to compensate for the loss of their insurance or their investment portfolios over this time. For suppliers and technology suppliers, I think startups are having a hard time finding money. The meeting next door, I think I'll be very surprised if one of their conversations is about how difficult it is to find startup money. The investors are very, very leery of risky investments at this point. We, in fact, we have a animal research laboratory that will be moving down to Technology Enterprise Park here, and we've seen 3 major sponsors defer studies because they didn't have the money to get the credit to do the studies. So we're seeing it, hurt our own research work. But for those of you that service the research industry, the companies, the startup companies that want to do these studies so they can get FDA approval are not finding the money to do the studies. The inventories, of course, are piling up, and those that are trying to sell, that's somewhat good news to hospitals and doctors because they can buy things maybe less expensively or get better deals, but at the same time, that discounting is hurting those suppliers. The government. The states are having a very difficult time funding Medicaid, and they're looking potentially even at a bed tax in the state of Georgia. It's going to be difficult for the providers to swallow when they're already losing money from the economy to swallow a further tax to fund the Medicaid system. So that's going to be a little bit of a difficult process through the legislature this spring. But I think that in terms of how it affects the healthcare sector, the state's inability to fund Medicaid is probably the biggest impact. And for those hospitals that rely heavily on that, it's a big deal for them. Public policy, I think, will probably be hurt. I think the agenda to support preventive health care issues and to look forward to ways to do the smart thing to prevent illness, those typically are in the discretionary category. Those will get cut as opposed to meeting the here and now, the needs of the sick here and now. But the preventive things that really ought to be funded will probably get cut, sadly so. So if you're in the tech sector that's tied to preventing illness, or dealing with consumer ability to prevent illness, and it relies on any kind of government funding, I think that's going to be hurt for a while. Overall, I think it's a hunker-down mentality right now, just weather the storm, less risk-taking by providers and the government for the most part, and certainly by insurers. There's a shortage of capital to make those innovative decisions that you need to make to move forward to weather these kinds of storms. Those with a good balance sheet will survive fine. Especially if they have understanding either stockholders or stakeholders that see the long-term agenda. I suspect the worst is yet to come. I don't think we've hit the bottom of this recession by any means, especially as it affects healthcare. I think we've got another 6 or 8 months of very, very tough sledding. I think the last quarter of 2009 will finally start to pick up. I think we'll see a lot of relief in 2010. And then if you're a supplier to the healthcare industry, I think you'll see a lot of business in 2010, but you won't see much relief in 2009. I think there'll be some failures and some mergers that might not have been predicted a couple of years ago. And there are some good targets for acquirers out there in whatever these sectors that you're in. However, there are some bad targets, and those are the ones that are failing, and they need total redos if they're going to be acquired. 2009, I predict, will be more tumultuous than 2008, if you can imagine that. I think in the credit markets and every sector, I don't think you'll see major bank failures. I think they've finally been rescued, but now you're going to see the ripple effect into the business. Alcoa just laid off, 15,000 people worldwide, and they weren't even talking about that 4 months ago. At the same time, I'm an eternal optimist. Out of every crisis comes an emerging opportunity for a paradigm shift. And I think this might be one of those times. You've got a president of the United States that is about change, that's about paradigm shift. And I think if he can use this opportunity and doesn't get caught up in some other issue, I think there could be some serious paradigm shifts in how healthcare is handled. Consumers, I think, will emerge more powerful in terms of their ability to manage their own information well. And if we look back in history of when paradigm shifts occurred, they came out of crisis. They didn't come out of comfort. They come out of crisis. And so I'm not sure what the paradigm shift's going to be, but hang on to your hat. I think you'll see one. It's coming. So if you're in the tech sector and supplying folks in healthcare, be ready. You won't get much relief in 2009, but you better be ready for 2010 because it's going to come at you, and there'll be a lot of pent-up demand for your services. So those are my comments. Hopefully that stimulated a little bit of discussion for you. You bet. Thank you, Mark, for the privilege.